You're watching Let's Chat.
It's been a quick spring. Summer is literally right around the corner, and for a lot of folks, that means travel, both foreign and domestic. You don't want to have your vacation or your travel plans disrupted by any sort of illness, especially one that can be prevented. Dr. Stephen Miller is joining us now with the Hamilton County Health Department. Dr. Miller, good to see you as always.
Thank you.
As we get closer and closer to the busy summer travel season, we want to talk about vaccines. Before we get into domestic travel, actually before we get into travel abroad, what about domestic travel? If you're leaving here, Chattanooga, and flying to any one of the continental United States, should you get vaccinated for anything, or should you double check?
That is a great question. A lot of people underestimate that. It is important to have not only your hepatitis A, but it's a good idea to make sure your tetanus is up to date. A lot of people are going to be backpacking, they're going to be visiting waterfalls, they may be staying at different hostels, things like that. So that's a great opportunity to get those particular immunizations up to date.
When's the last time any of us watching or any of us here in the room had a cut or an injury of some sort and the healthcare provider says, when's the last time you had a tetanus shot? Who knows? Do you know the last time you had a tetanus shot?
I know the range, but that's exactly right.
See, that's exactly right. So you do need to make sure that you have all of that and up to date.
Exactly.
All right, travel abroad. Let's start with the closer countries, either Canada or Mexico. What do we need to be on the lookout for?
Usually for Canada, not important, but for our Latin American countries, it is important to check and see what vaccinations you require. And that's one of the reasons we have our travel clinic here at the health department to help prevent not only from us acquiring infections abroad, but also taking things that we might have to other countries.
All right, Dr. Miller, I am leaving Atlanta July 19th, and I'm traveling to Europe and Asia. What do I need to be vaccinated for?
For most European countries, not a concern. For most of Asia, not a concern. But if you're talking about Southeastern Asia, there are many things that you need to be mindful of. They do have such entities such as malaria and yellow fever, Japanese encephalitis. And it's important to check and make sure that you're not at risk for that, especially if you're going with a mission trip and you're going to be in the back country and rural areas.
Several years ago, a friend of mine and his two sons went on a safari covering a good part of Africa, which, as you know, is a huge, huge continent. He was telling me that there were a number of vaccines that they had to have. What would they be and what would they be for?
Well, that would probably be your yellow fever. Remember, yellow fever has over a 90% mortality rate on if someone receives that infection, and yet if you get the shot, it pretty much completely protects you from it. So that's why it's so important for areas like Kenya and things like that, which are popular, as you said, safari and destination sites. A lot of people are going to these countries, and they will not let you in because, once again, they don't want you to acquire that infection. And we ourselves, we had a yellow fever epidemic here in Chattanooga back in the late 1800s, 1876.
Now, think about what Dr. Miller just said. You made the plans, you put down the deposits, you're out all this money. You get to customs in one of these South African countries, they don't let you in.
Not unless you have a medical condition or you're of a certain age that you're exempt from it, but that's far and few between.
Could you imagine being in that predicament?
No, you've put a lot of money, investment, and time and planning into that, and then all of a sudden not be able to go on that dream vacation. That would be disturbing.
What is the best resource that you could point us to as far as I'm going to this country, I need to be vaccinated for this, I need to look out for that? You have one of these travel clinics right here.
We do. We do travel consults where we not only go over what immunizations you need, but we also educate you as far as water and food protection. We tell you what animals to watch out for in terms of exposure to possibly rabies. So there's a whole process. Each country has its own potential pitfalls and dangers that you need to be aware of.
And a lot of times you hear traveling to a foreign country, even if it's as close as Mexico, don't drink the water. There's a really good reason for that.
There is. Unfortunately, sometimes Just it may not be that the pathogens are bad to the natives there, but they are different in things that we're not used to here. And that's actually a common cause of infections is individuals that are born in these other countries, they live here as citizens, they go back to visit their home country, and they don't realize they're no longer immune to those infections, and sometimes they can bring that back. So especially individuals born in foreign countries, they need to be especially mindful of when they go back.
Dr. Miller, we're up against the clock. Thanks so much for joining us.
Thank you very much.
Find out more about where you're going, what you need to be vaccinated for, and the time frame in which to do it, because depending upon the vaccine, that does change. Check them out on Facebook or call them at 209-8340, 209-8340. We'll be right back with more of Let's Chat after this.